Oh, her mic is on mute. Suchita's mic is on mute.
She's looking for.
They're recording, so you can ask them for one later. There we go. Yep. Oh, went back on mute. No,
Good.
no, not anymore.
Oh.
Went back on mute. Okay, so you're the only one who's not muted right now. Why don't you ask if they can
She's
hear you?
trying.
That's okay, but why don't you ask everybody if they can hear you?
Can you hear me, Suchita?
Hello,
I
ma'am.
can't
Good
hear.
morning. How are you?
Oh, good morning and good to see you after 17 years.
Thank you, ma'am.
Look beautiful as you were.
Thank you, ma'am. You are the same, ma'am.
Yeah, old age is there.
Ma'am, you are still young.
Yeah, young 80.
Yes, ma'am.
I'm glad I said yes because I didn't know you will be there. And this is a bonus for me.
For me also, ma'am. I really good to see you after a very long time.
Yeah. How is the family life?
Yes, good, ma'am. My
Wonderful.
husband is in Delhi and I'm working in Gwalior.
Oh, only 3 hours. If you can go there, but I
Yes,
don't know if
ma'am.
they are allowing. You can go? You can travel these days?
No, ma'am. Because
Yeah,
of
you
that
can.
lockdown and that
Yeah, still
COVID-19.
lockdown.
Yeah.
Yes.
Because of my son, no, he's 9-year-old only.
Oh, bless him.
Thank you, ma'am.
So still we are waiting for Farooq.
Yes, ma'am. He sent message that.
Hello, good morning, ma'am.
Good morning, Farooq, sir.
Yeah, how are you, ma'am?
I'm fine and thank you for inviting me. I'm honored to be here.
Yeah, I'm also very much obliged, ma'am. You have given us a time to present, and really here so many persons are waiting for your presentation, ma'am.
Oh my goodness. I hope I live up to their expectations.
Yeah. And thank you to Suchita, ma'am, also.
Thank you, sir. Thank you very much.
We will wait for at least 5 minutes, ma'am, because participants are joining.
Okay, no problem.
Yeah, ma'am.
Farooq, do you know Suchita was with me, my colleague in GNC Gwalior?
Yeah, I heard because about you also I heard, ma'am, because day before yesterday only I came to know that you have worked in here Sophia
Yeah.
College.
Yes,
GNC.
Sophia also.
Yeah.
Is
So,
Dr. Bhalla still there?
yeah, Bala ma'am is still there. Now I think so. Principal, ma'am, who is the principal there? Suchita ma'am.
Puri, ma'am.
Yeah, Puri ma'am.
Oh, there was Trivedi ji when I was there. And then Farooq Begum, Major Begum, Farooq Khan.
Yes. Yes.
Do you know her? Do you know
Yeah,
her?
I know her. I know her.
Do you know about Juhi also?
Juhi ma'am, I think so. I don't know.
Her daughter, she passed
Okay.
away so young. After delivery, her baby was only 1 year old. And she passed away with a heart attack.
Okay.
So sorry.
And now Khan madam is so alone and
Okay.
So sorry to hear this, ma'am.
okay.
This session is on live also on YouTube. So YouTube, so many person who have not registered, so they are watching on YouTube. So welcome to all the participants?
Oh, more the merrier. They are most welcome.
Yeah. Only 4 minutes we have to wait, ma'am. It is 9:26. Ma'am, what is the time now there?
Almost 12 midnight.
Midnight. Oh my God.
Yes, sir. That's all right. I can adjust 2-3 hours. But if it was at 3 p.m., it means I cannot take any meds, I cannot sleep, I cannot do anything.
Really?
And now also, after finishing, I will have my late supper and then some meds. And by 2 or 2:30, I will be sleeping.
Oh my God.
No, that's good. That's good. I can tolerate this much, but not 3 or 4 p.m. Indian time.
Yes, ma'am.
And thank you for accommodating.
Yeah, thank you, ma'am. Thank you so much because of us, you are in night time. You are also there. You have not
That's
taken the
fine. And I thank my son also, who is a lawyer, but he is my baby son, and just walking me around step by step with the technology.
Oh, thanks to him. Thanks a lot to him, ma'am.
Yes, I am doing that. You can say welcome.
Yes, hello. How are you? Thank you.
Hello, sir. How are you, sir?
Good. Thank you.
We
Thanks a
both
lot,
are
sir.
late sleepers.
Yeah, no problem.
We both are late sleepers, coincidentally, so it worked out well.
Okay, ma'am.
Are you putting me the PowerPoint for me, or I will be
No,
sharing?
we have to do it from here when they're ready. We can share.
Okay.
So, ma'am, are you going to present?
Yes, and we have the.
Yes, and I'm waiting
we
for
can share-
sharing.
We can share now. Hold on. We're gonna go ahead and start our slide.
Suchita, ma'am, shall we start? Or 2 minutes?
Yes,
we can wait?
let me put the slides
We
on.
can wait, but we'll start the slides on the screen anyway. Okay, we'll leave it there until you're
Yeah,
ready.
it is visible.
Yes, okay, good. Yeah, so just put that down there.
So, shall we start?
Yes, ma'am. We can start now. This is now 9:30.
Okay for me. Enough.
Welcome everyone. Thank you for joining us for today's webinar. My name is Suchita Prabhakar. I serve as principal in BIMA Nursing College, Gwalior, and treasurer of the Nursing Teachers Association, Gwalior. TNTA is a page all the nursing staff in one platform for socialization and for professional development. Today, we are presenting our topic is role of nursing organization in healthcare system, healthcare reform during COVID-19. So today we are presenting in our first session, COVID-19 and present scenario, presented by Professor Dr. Suresh Narula Khanna. If you have any questions during the presentation, please type them into the question box in your Zoom. I will bring up during the presentation, and we will also have time for question at the end. Our speaker has spent almost her entire career in giving to the individuals and nursing organizations worldwide and teaching people in the field of nursing education in places like US, Canada, and India. She has earned many national and international titles for her contribution in the field of nursing science. She is an international speaker, researcher, educator, and a dynamic leader. Despite her busy schedule, she accepted our invitation, and we are very honored to have her in our midst today. Now, without further ado, so Ladies and gentlemen, please join me in welcoming Dr. Shrish Khanna. Please, ma'am.
Namaskar, greetings from USA and blessings from New York. As you know, my name is a little bit hard to pronounce, so you can call me Sue. Okay, Suchita? Sue is fine for sure. Yeah. Okay. I want to thank because Farooq sir asked me to join, and for me, this time is very suitable, and he was able to accommodate me. Thank you, Sir Farooq. And also Suchita, she was my colleague. I'm so pleasantly surprised to have her here after 17 years. And she and I worked together in GNC and Gwalior when I came there as a director of College of Nursing. Okay, I'm starting with you the session 1, which says COVID-19 and present scenario. I may be very blunt to start because I want to start with the quote from Director General of WHO, Sir Tedros. He said, "Let me be blunt. Too many countries are headed towards wrong direction. The virus remains public enemy number 1." So if you see on the chart, how the scenario started was December 31st, 2019 from Wuhan, China, and it spread overnight and came from January 1st. We started seeing all these patients positive and getting sick with this. There are 4 countries which are at the top. Thank God, India is not one of them. For example, USA, Italy, Spain, France. So if you see at the confirmed cases, how many lakhs of cases are at the bottom, this world cases, and in India were only, now in India, they are about 6 lakhs and 720 plus at that time when it was spreading. Now, if we see the other slide, which says how much equipment we have, who is getting protected? Are the personnel who are helping these sick people, or are the employers or the fire people who are in the first runner-ups and responders? What is happening? Look at this data. In this scenario, we have only coveralls available with hospitals 3 lakhs, 3.34, 3 lakhs to be received from abroad. Like if USA can send, because USA was very quick to ask our Prime Minister for hydroxychloroquine, and he received in tons of those packages. It may not be ultimately used, but he was protecting and preventing his country's citizens. Now 10,000 coveralls are donated by Red Cross, and 10 lakhs orders of PPE kits placed through MEA on the Singapore-based platform, 21 lakhs orders for coronavirus to 11 domestic producers. Now, 95 masks, they keep on saying, leave them for the responders or who are directly working with the patients. And currently we need 50,000 of those. But I saw on the pictures somewhere also, N95 masks are worn by public, which they are saying not to. 1 lakh per day by next week, and details are these from 30th of March. Now, in quoting the states about the current situation, and these are the latest figures from 14th of July. I don't want you to be having number numbness, but a little idea about what is happening in different states in one country. And we are talking about more than 225 countries in the whole world. Now, if we look at Maharashtra and Tamil Nadu, continues to lead the coronavirus caseload of the country. The Western state on July 15 reported a spike of 7,975 new infections, taking the total vital or viral load to 2,75,645. Then Maharashtra also had 233 COVID-related deaths in last 24 weeks. Total there is 1,52,613 people who have beaten the disease. So we should be patting on each other's back that we are doing something good to have less number who had been sick, but they are being released. Other facts and figures, I don't know how much you can absorb, but I want to go through still. 3 countries surpassed China's COVID-19, and they are US, Italy, and Spain. France got after Germany now. And China is still on number 4. Then the coronavirus curve. If you start from those December 31st, there is no decline at all. And the world number is going up and in the red line. Then if you follow on Tube or Google or wherever you can, tracking India's trajectory, India is still high, but not that high. Look at those Spain, Italy, US, France, UK, Germany, and look at China is next to us, still higher, but next to us. And India is at the lowest. But again, you and I, we are entities, and we are so loved with by our relatives, families, and our country fellow men. So you cannot say that this figure is lower, so we should not be worried. Each one life is very important. Let us see south part of India, in spite of all restrictions, because South had been pioneer in leading with the protection and prevention measures. In Tamil Nadu, total number is 1,51,820, including new 4,496 cases and 47,340 active cases, and only 68 deaths. I should not say only, but 68 deaths in last 24 hours. In Karnataka, the total of 47,253, including 2,167 deaths and 3,176 new cases. The good news is that in India, the recovery rate is increased. Now, the latest I read, it was yesterday 63 point. Today, they are saying 63.4, which includes 1,647 new cases. 20,572 people recovered in last 24 hours. Very much kudos to the frontline heroes. Almost 6 lakh people have overcome the disease. At present, the total number of active people is 3,19,840. Let us see a little bit on revisiting COVID-19. Everyone knows by this time how it spreads, what is this and that, but just a few slides on that. COVID-19 is a disease caused by a new strain of coronavirus. CO stands for corona, VI stands for virus, and D stands for disease. Formerly, this disease was referred to as 2019 novel coronavirus or 2019 nCoV. How prepared we are? India versus some other countries. Look at first 1.5, China 2.7, Germany 12.9. Germany is leading at this point, and USA, UK, all are left behind. And you cannot talk about the other countries, what is happening there. So India is still very behind in preparations. How prepared we are with the doctors? India versus some other OECD, all countries, the doctors are per 1,000 people 0.8. China 2.0, and again Germany has 4.3. How prepared are we with the hospital beds? India versus again other countries, and I cannot take 225 countries, but I took them the lowest and the highest. 0.5 again, we are not prepared with beds at all. And here, just to let you know, in United States, they have turned all Lincoln Center, all those playful, where they were having all plays and all, they are turning those halls into these coronavirus prepared beds. Germany again leading with 8.0. Now, signs and symptoms, again, there is a change in the list. The old signs and symptoms list was from CDC, and CDC was saying 2 to 14 days will be when the symptoms may appear. And if we are exposed like today, after 14 days or between 2 and 14 days, the people may be diagnosed with COVID-19 and they may be complaining of a set of symptoms, which include fever or chills, cough, shortness of breath or difficulty in breathing, fatigue, muscle or body ache, headache, new loss of taste or smell, sore throat, congestion or runny nose, nausea or vomiting or diarrhea. They may not be all together there, but they may be in combination of any of these symptoms. What CDC has done now has alerted us to include these signs and symptoms also. If the individual person is complaining in addition to these some of the symptoms, they will be to watch for congestion or pain in the chest, new confusion in the patient or person, inability to stay awake, or difficult to be aroused, bluish lips or face. These are the new addition of symptoms because there had been incidences of the heart involvement and cardiac arrest. In the past, it was only like a pancreas was considered to be involved or kidney was considered to be involved. Now heart is also included. It means any organ, vital organ of the body can be involved. CDC provides communities plan and respond and tools for operating during COVID-19, such as at business, workplace, childcare, schools, youth, parks, recreational facilities, colleges, universities, faith-based organizations, first responders, etc. Now, institutions and nursing organizations and nursing care will be covered in next coming 3 sessions. So bear with me. If I will not be addressing them, it doesn't mean I wanted to just ignore them. They are very vital, but they will be taken care of somewhere else. Now I will start with the first segment, the homeless and prevention. Though in India now there may not be very many, there may be Jugiwala or other areas, slum areas we call. Unfortunately, these names are given to them, but this will be the plan to work on and the points to look at how we are going to be in every nook and corner with prevention, protection, and treatment and post care of the individuals. In homeless people and resources to support them by planning, preparing, and responding. Ongoing mitigation guidance will include to know people experiencing unsheltered homelessness, homeless services providers during community reopening. Now, I heard in India, you are open and only weekend curfews are there. And here in United States, he has a plan, our president has a plan to open it, and he has given the phases. Today only, before coming, I was reading about those phases, what he's talking about instead of all these, which I will be sharing with you, which was first considered by CDC, and now he's giving only the 3 segments, like the individuals, they should take care, employers, and the employees are the hi-fi employers like Tata and those, what they should be doing. There were 2 more things left in that one. We have to be sending the people to test, do the testing in homeless shelters, considerations for state and local health departments, youth experiencing homelessness. In here, USA, a lot of runaways are there. So in India, I think it is catching up. I hear every other day, children running away from home for whatever the reasons are. Then COVID-19 Infection Control Inventory and Planning Tool, ICIP, for homeless service providers. Prevention and support components include CDC, EPA, you know, that is a Environmental Protection Agency, and CDC is the disease control centers. And disinfections, guidance. People I heard are spraying on people, this disinfectants. Please do not do that, do not guide them, and do not encourage them and stop them. People will die, if not with corona, they will die with this disinfection because they are inhaling, they are ingesting, it is being sprayed and they are getting drenched with that, and it is no. Then screening for symptoms, homeless shelter work training. They must be trained how to work with the homeless. If you look at the big section, it is our children, our precious treasure for the futures and future generations. Now look at childcare, schools, youth programs, and they should include the guidance and planning for interim guidance for KG and 12 schools and children. Testing in KG and 12 grade schools. Work safety and support resources. Checklist for teachers and parents. And I included this because I am experiencing with my 3 grandchildren at home between the age of 10 and 14, and they need all kinds of tips for the parents and grandparents how to deal with them and when they are out of the school. Youth sport programs and talking with children. Please talk in not medical language, but in simple language. They should be aware of what is going around in our crisis and pandemic. Next segment is to take care is parks and recreation. Being the June and July month and summer when Indians love to go to the mountain areas and to the beaches. So I included these parks and recreations. Park administrators should be aware of these plannings, cleaning and disinfection, and visitors around the beach, considerations for aquatic venues, how they have to be taken care of, extra care during corona, and considerations for youth sports when they are playing around in the sand, and considerations for public beaches, considerations for traveling, amusement parks, and carnivals. There are not many carnivals in India, but there are a Kumbh Mela, there is a religious Shanaan, and there is something else going on. So considerations for traveling, amusements at parks and carnivals or festivals or religious activities. Work safety and support. Then next is first responders. First responders including law enforcement, public services, and they should include in the plan mass transit administrators. What they should be doing. It's not only the public, but the other people who are working around should be taking precautions. Then guidance to plan all these individuals, how they will be utilizing these important wearing of PPEs and whether they need it or not. Then prepare and respond to COVID-19, specially, and work safety and support. Then CDC, EPA cleaning and disinfection guidance, preventing steps for firefighters and EMS, those emergency medical services, responders or providers. Because in one situation I just heard, Dr. From AIMS, I think, in Delhi, he was bringing the patient in ambulance and there was nothing more available. He removed his mask and saved the life. And now poor fellow is in quarantine and positive. Very sad to hear. And I was so encouraged by the father who said, you are at the right time and you saved the life. And being a doctor, that was your duty. And I'm so proud of those parents who are keeping up front courage and encouraging their loved ones who are working as frontline heroes. Then preventing steps for law enforcement personnel, because when they get the prisoners, you don't know because I heard the stories from Mumbai, I mean, that these people who came from the religious mosque, they were admitted for quarantine and they were spitting on nurses and on doctors, and they were urinating all over. Oh my goodness, this is what we have come to. And these things are these front providers involved in. You never know how these prisoners are going to just go and behave. So preventing steps for law enforcement personnel, possible exposures of critical workers, healthcare personnel, and first responders guidance. How to cope with stress and build in resilience. That resilience has to come not from within, but from outside encouragement also. Only banging on those thalis and is not helping, but sending them individual notes. If there is a mutual communication and they can communicate on the cell phone, if they are allowed to in working conditions. Then what workers and employees can do to manage workplace fatigue during COVID-19. I saw horrible pictures of those individuals who are in the corridor just lying down on the floor, just lying on the trolley, just lying wherever they're getting the space. So those have to be just keep in mind with the empathy. Then community faith and community places, I will not go over in detail, but a little bit giving you the hint. Scaling up operations such as establishing and maintaining communication with the local and state authorities to determine current mitigation levels in your community. Providing protection to staff and congregants. The congregation, if it comes, some of them may not be having even simple mask. So you have to be prepared to assist them. Then strictly adhering to the federal and state laws, communicating and notifying them if there is anything found in the churches or temples or mosques. The social service provider community should be following schools, workplace, and business prevention guidelines. The social service workers are also frontline workers. Then hospitals, workplaces, business, colleges, universities will be covered under institutions. And if they are not, Madam Suchita ji has my email, and I will leave with her at one point all the answers if I have it and what I am capable to, and you can contact, and she will be your resource person if you have any questions. But as far as I know, these restaurants, bars, banquet halls, they should be covered all under institutions. Now, I have a passion for this segment. Nurse midwives, being a midwife myself, being in the situation doing home deliveries dissertation, staying 4 months in India in rural areas, I think it should be addressed in this present whatever we are discussing now, and we will be just addressing a little bit how these rural area midwives are just going through hell. Another area of present scenario is the nurse midwives who are working with pregnant women during home deliveries in rural India. The midwives working in institutions will be addressed later on as personnel or employees in institutions. But our session in COVID-19, I included is the rural part. It is neglected according to the individual report of nurse midwives from West Bengal. The main concerns are of transportation, supply of equipment, special set of universal guidelines, women and incoming neonates or delivered neonates during delivery and lactation period for breastfeeding. It is very hard to maintain social distance while helping the delivering mother. How you can be away from the baby and vagina, then being delivered and during breastfeeding also. Dr. Subrata Sarkar, I have to mention her. She is the leading legend who has kept me abreast with all this, what is happening, what is being shared with her, what interviews she is going through. And if you all would like to join NNI, Nursing Network of India, she is extensively putting there in writing day by day, step by step, minute by minute report of West Bengal. And that's where I got. And she is my co-author also for publishing one of the articles. And she has given me this present information about those. And according to her, it is impacting our institutions, which will be covered later, but rural areas, especially home deliveries, where midwives are working in horrible conditions without equipment, without food, without shelter, where they should go when they're off duty, without substitute. Nobody is there, no supervisors are there to help them to manage or make schedule for them. And this crisis is more grave due to natural calamities such as floods. The pregnant, according to the Confederation of Midwives, is violation of human rights of pregnant women and their newborn. Even midwives are being violated by introduction of the inappropriate protocols and management of pregnancy during this pandemic crisis. We both produced a unified plan to assist these mothers, neonates, and we were sharing with our remote area people until now, and I want to make it a public and social. So if you people want to add some more things, we should go to the policymakers with unified plan, not in bits and pieces. So the children and midwives in rural area should be having all these planning in their scheduling and guidances. Keep update to with latest COVID-19 information and guidelines from CDC and WHO. It is the supervisor's responsibility, of our nursing leaders' responsibility to reach them, to communicate with them. Everywhere in the world, the mothers should be having an access to life-saving care. There's no life-saving care reaching some of the rural. Some of these, a WHO educator, Ms. Radha Saini, if she is around, I invited her also to attend. She shared with me that Punjab is #1. They had been going in such a difficult times on those jeeps and up and down, going zigzag ways and floods, and by boat, and they're trying to reach the rural areas, and I'm very proud of it. And we should take the lessons from this model of Punjab, and you can contact Radha Saini, educator. I will highly recommend her with any kind of these questions you want and how Punjab is dealing, and other states can follow. Efforts should be made to establish hotlines in institutions 24/7 that midwives from rural areas can communicate in emergencies. Many hospitals may be having it. I'm not ignoring them, but it should be with all the institutions. Provisions should be made to support our midwives in terms of work environments, supervision, workload, resource allocations, food and shelter after off duty in this trying time of pandemic crisis. Now, WHO also, in addition to these, for especially for midwives, has shared these 6 steps recently that every country should follow. In addition to those provisions, we should follow 6 steps outlined by WHO, which any country, regardless to size, can take, and those steps include: 1, expand, train, and deploy your public health force. 2, implement a system to find every suspected case. Tracking system should be updated. Ramp up testing capacity and availability. Please, everybody should be writing to those policymakers and our government. Ramp up and identify and adapt key facilities you will use. Treat and isolate patients. Develop a clear plan to quarantine contacts. Now, refocus the whole of the government or suppression and containment of COVID-19. And Dr. Subharta, again, he's very active, and we are exchanging those ideas. She has suggested 6-layer strategy of management that start from the grassroots level with slogans, handouts, cell phones, communications to border vigilance. If those people are going from one state to the other, like we are going from here to Canada, I will be in 14-day quarantine, and I have to carry those ID cards, testing results and everything. So follow those. Holistic approach. Then means of tracing possible contacts, preparedness, guidelines by health ministry, and providing care and support to the caregivers. Testing in COVID-19, you may be knowing a lot of it, but if those people who do not know, I just want to update. I may not go into details of each test, but please bear with me. You can again have this information, all is in Google and on networks. But nasal swab and saliva sample, they are in the kit, and they are suggesting they should be provided those people who are locked down in the houses or wherever they are at the duty. Then nucleic or antigen testing inappropriate in individuals who have actual signs and symptoms. I wrote names of about 6-7 tests which are ultimately reaching to the same goal. And those tests are: one, which is SARS-CoV-2 antibody test, that lateral flow method. And second is COVID-19 IgM and IgG antibody rapid test, and Zehan-Levison diagnostics CEIVD. Then third one is COVID-19 IgM IgG rapid test, biomedics stress, and new convalescent test coronavirus, which is biomedics again. Then is IgM antibody detection card test, Vanguard Diagnostic in India. Then there is Make Sure C19 rapid test, which is called HLL Life Care Limited test in India, provided by HLO. Then YHLO SARS-CoV-2 IgM and IgG detection kit. Additional equipment is required. So all these tests are going to reach one big result, whether the patient is positive and how it is to be held. Now, some of the labs are providing, I heard, the test within 3 to 5 days, but some are taking 14 days. So wherever, in whichever state you are, you have to find out the protocol yourself, or you ask Suchita Ji's, and we will look into it. The recent analysis done jointly by Duke University, Center for Policy Impact on Global Health, and the Public Health Education of India, and they are also working on the concise type of test which should be standardized universally and should be approved by FDA. FDA here is called Food Drug Administration, and yours is, I think, ICMR, that Indian Council of Medical Research. Now the treatments, let us have a look at new drugs or treatments claimed to be curing the disease. Besides plasma therapy, I will come back to plasma therapy, there is a newer treatment going on. And hydroxychloroquine, and many other protocols and administering combination of drugs. If you are interested in knowing those, I will take the names of those medicines if possible, but at this time, you may not even need them. And those are in combination, and they are called lopinavir, ritonavir, and hydrochloroquine for prophylaxis. And there is one more, which is polyhybrid powder. And those herbal powders are in India, which I found out by Ayush. Ayush is Ayurvedic, yoga, naturopathy, Unani, Siddha, and homeopathy combination of these who are giving all these homeopathic or Ayurvedic medicines. So one name I just got is poly herbal powder, Nilvam Bukdu near or Bakdu near. So please, if you find it out, just to share with Suchita, and she can share with me also what is going on in these. Now, I want to share with you is the last and latest one treatment, which is given here. And if time permits, I will come to plasma therapy, which Israel is a pioneer in that, and they are claiming they have found antibodies. And from one person who had been positive, they can take plasma and give to 4 positive patients who are suffering to treat them. So I will come back in details how they're doing in rats and what is happening. But the one which is a nebulization, and the claim is by Dr. Robert Bartlett, who will be going to meet our president and get it patent by FDA. His claim is that patients were cured 100% for coronavirus infection simply by administering Pulmicort, which is a steroid nebulization, and helped patients to have anti-inflammatory effect, and patients were able to breathe easily and have their stamina to cope up with these mild cases. And regarding this steroid therapy, if you know, for centuries we are giving this therapy to the asthmatic patients. Asthmatic patients have difficulty in breathing with the inflammation and the sputum and all those other things, you know it better. But the point I want to make is, if on the spot where the problem is occurring, we go and help, and the patient starts breathing, we do not need ventilators and the intubations. And that's what is his claim. And he came on our CBS channel on TV day before yesterday, and it is on Tube also available, YouTube, if you want to watch the whole interview with him. And he was not giving Pulmicort too loudly, because we are not supposed to encourage any brand names, but steroids. Okay, the Dr. Bartlett I name gave you, if you go on Tube that you want to watch CBS TV interview of Dr. Bartlett, and it may show. And he calls it, Dr. Bartlett's found out silver bullet. Pulmicort or steroids is his silver bullet. Now, Farooq, do we have more time?
Yes, ma'am. We are having
Then-
sufficient time.
Okay, then I would like to share the things I had on the side. And those are, first, new researches and their topics. There may be some researchers sitting there and they would like to know what is going on. This CDC and WHO has given, and you can find out from your ICMR also. And I would like to share only 6 and 7 names where they want to do the research, because we are in this scenario and we should know from here where we should go. Today to know, and now will become yesterday, and yesterday will become again, tomorrow will become today. So we should know what's going on from political point of view. The new researchers' names are given, total cases worldwide, depending upon that, the travel and tourism in India, very, very important to do the researches, because they found out those travelers who on opening the lockdown came from China, they were 100% positive. And they went into other areas and they have involved thousands and thousands of people. So they have suggested we should do the travel and tourism research in India. Then automotive industries, then IT industries, then state of health industries, then exports of India, because there are myths going on, whatever the bulk they are getting packages, they can have the postal baggages can spread infection. So our economy is going very down. So please look into these. Then fake news. This has become an item of research. I'm surprised. The social media plays a, naturally it is playing a role now. I'm on a webinar and you are all here and there is privileges here, but there are always pros and cons, and some people go to the length to misuse of it. And I have published an article also in a prestigious our ICGMR from Rajasthan Nursing, that Journal of India. It is an indexed journal, and I have presented also, and this published has journal article has all social media and technology, communication, and these two friends, how they are impacting and helping our research and nurses. Then COVID-19 itself, coronavirus, economic impact of coronavirus in our Indian economy. So these were some of the top-notch medicine or medical research items or statements which they want to see how it affects our economy. Then there are 9 myths. 9 myths in India, they are surprisingly what I had been doing it as a precautionary methods and means, and they have all nullified all these. Maybe the person who did this surveillance research with an Indian health personnel, and they have found these 9 things are only myths. They do not add even a penny or a coin or a dent in preventing COVID-19. So those are 9 myths. Spread through parcels, postal parcels, and that is a myth. 54% Indians believed in that, yes, it can spread. Then second is exposure to sun, which I had been doing, opening my mouth, standing there, breathing in with nose and opening to that, at least it may be helping some sunlight in my mouth, which is totally wrong. 30% did believe that it can prevent COVID-19. Some people may be sunlight sensitive. Please make sure children are not sitting there and copying all these for fun's sake. Then eating garlic. Only 34% still believe eating garlic will prevent COVID-19. Then the other myth was, fourth myth was PET scan transit C19. 36% in India believed in this myth. But here, every other house has pets. They are very fond of cats, very fond of these puppies, and they were concerned, and the surveillance said it is only a myth. Then hydroxychloroquine, that it is a cure. This was a myth. 60% were believing into that, including our president also, who ordered tons and tons of it, and it is such a wastage now. And instead of putting a mask, which he did today, when he just opened that area and faces, otherwise he wasn't even using the mask. Instead of all those 3 things, hand washing, distancing, social distance, and putting those in his conferences, press conferences, till yesterday he was sitting without mask, but today he was shown with mask. Then 5G mobile can spread infection. It is a myth. But what happens is we do not understand, or we ignore it, that ordinarily when we are using a cell phone where fingers are going there, contamination is there, we are not going to this scrape it and lick it, because we are just touching it. Just don't touch your nose or mouth or ears with these contaminated hands. Just wash it. So 5G is not a source of infection. Then antibodies and positives cannot, those positive people and those who have plasma antibodies, they cannot get infected. This is a myth, very serious myth. And somebody yesterday's TV channel 18, I think yours, somebody asked that question to Dr. Who was from Lady Harding, and Dr. Saab said that it is not a fundamental or a cure thing guaranteed. We do not know yet whether they can get second time infection, or those positive people cannot get infected again. Now, one question was there whether if a person, same person from the lockdown in the house, he got the first test positive, then automatically he went for the negative. But if it is a first test negative, should he go for the second test? And doctor, for somehow when he started saying a little bit of headache, little bit of taste gone or something like that, one or two little symptoms, the doctor sent him, and that came positive. So thank God to the doctor that he used his common sense. Even a slightest doubt, please get tested. And if there is a one positive, one negative, go for the positive for safe side's sake. Now, children cannot get infected. That is a big myth. It may not be in thousands. It may not be in hundreds. It may not be in 2 digits. But I have evidences. One 6 weeks old in our state of Connecticut, where I am at the present, and it was shown that we lost one baby with infection. Where did he or she got it? From the vaginal canal, from the distancing was not there when they were helping for delivery, who was there with positivity, doctor or other health workers or nurses who scrubbed for that, and then they were holding pediatric doctor, pediatric nurse, who was that person? So it is very hard. So it is a myth. Then one Japanese doctor found out about 10 years in that range between 9 and 12, the children were coming with Japanese syndrome, and they found out that Japanese syndrome people tested positive. So whether there is a link with that or whether it was a coincidence, so they are now saying keep an eye on children also. Then there was a myth that infection stays for only 3 days. This is a big, big myth that it stays only for those days. Now, there is something else I want to use this time is the therapy, what Israel is talking about. They are talking about, and it was just today I heard it, and there was one fellow who explained in Urdu, and it was easy for me to get a little bit of those bits and pieces, and I came up with what he meant. He was saying if there is a person who was very sick and came out and had a plasma, they are taking that plasma from one sick person and giving to 4. So you can imagine if there are in lakhs in India, how much and how faster we can get into. Then somebody suggested, why you are not using the pets like rats we are using in other researches. So he explained that we need enough of antibodies. And if we use one rat, it is not even one human being. It has to be 10 to 20 rats for one supply of those plasma therapy. So it will be in lakhs if they're using rats or what they're doing it. So it is not practical. But they are coming with the synthetic, and they are saying, if we take cancer cells, which are known for that multiplication, proliferation, And with the proliferation, they can use those cancer cells and the lymphatic cells, which are able to help in producing those antibodies. And if with these combinations with the antigen added to it, they can produce those plasmas and we can help masses and masses in the world. So that is what I could understand from him. And he used one word which was to me, he called it, and I'm not getting to that one. But anyway, he called that synthetics some word, which we can find it later on. So come to the conclusion. Looking at the COVID-19 and present scenario, this pandemic crisis has shaken the whole world. And the CDC and WHO, according to them, the quote is, the pandemic crisis is getting worse and worse and worse. These are not mine, these are in quotations from them, that it is not getting anywhere near to the consolation that we are reducing the numbers, but again, many of them are not tested. That's why we have a reduced number. The capacity of India is only 4 lakhs, where we need 40 lakhs, where we need in masses. These capacities have to go up. Other solutions have to be in situation. The most affected areas are the low income areas. That was the finding. And the rural areas in India especially are problematic areas, and we should start paying attention to the masses who are living there. In the past, yes, there were 80%, but now they may be only 40% in the rural areas, but 40% does count. Every life counts. And the natural calamities are adding to the already worse conditions. This is affecting midwives who are front warriors and the pregnant woman. I should relate 2 stories of those pregnant women. One woman was saying, if I go from here to the institution by hook or crook, how I can be assured that I am in a COVID-19 free situation? How can I know? How can I be reassured? Where are all the ID cards for those people who are working there or the visitors and their families? Then there was another story, a twin pregnancy person. She said, I'm not going to bring my babies there in the institution. They are better off at home. At least only they are exposed to my 3-4 family people and one guy who had been helping me. And they were addressing and pointing out, and I'm so proud to also, ANMs, ASHA, AWW, and those dyes, traditional dyes, those who are really there to help. Where is our public health nurse there? Very sorry to say, health visitors, and I do not blame them also, because they are given such a workload, 3-4 villages under them, then plus working in the health center, primary healthcare center. How can one person be that omnipotent like God everywhere with multiple hands and helping each other? And it is like very hard, because I was the first person who observed them for 4 months when they were delivering in the homes. Though I lived with Katmals and all other things, but I will not go sidetrack with that. So these 2 stories should give you enough to ponder that we should be addressing these workers who are in the rural health area. There is a great need of extra precautions, extra PPEs, and also we have to restrict these people who are going on the outside on the roads. They need not to wear it if they are maintaining social distance. And here in United States, they have made circles. And I saw in some of the areas in India also, they have made it that they should be 6 feet or more, not less than that, and masks. Now they are becoming really ridiculous. I had cartoons of 20 masks I will try to show you on my this one cell phone, if I can, that those masks are ridiculous. Some are of the swimsuits, some are of the bikini, and one person have a shoe covered with her scarf and putting on the mouth. Some are in the whole area covered. What's going on? We can be ridiculing them, but please contain it. Have some social conscientiousness and consciousness, because we are sending wrong messages to people who are not knowing much, who are ignorant, and to children who are sitting at home and being creative, but in the wrong way. Because it is happening to me every day when we go to the swimming pool or when we are in the house and they cannot have those water guns and all. I mean, what's there? Not to encourage them with all this, but encourage their value system. Now is the time. Whatever religion you are following, I am not advocating any particular religion, because in my household we have 3-4 different religions following them, and we are very tolerant to each other. So we should be tolerant to each other and follow whatever you have. But I know in my heart all the religions, all the faiths have the same ethical sanskar value system. We cannot inject, but we can instill still, sitting at home and utilize this time and not getting over panic. What they are doing, they are making everybody nervous, and the stress level is going very high. We are doing those studies in the psych research area also, but we are not helping each other, empathizing. Now in institutions, I should not be going into that area, but here we have the grieving committees, meetings, groups who are helping individuals, going there, supervising them, saying just hello to them, encouraging their morale, boosting their morale. And we should have that. I heard a very horrifying story of one pregnant nurse who was on 8 months. And you all might have heard from Ashok Chauhan husband. He wrote in Facebook also their story, how horrible it can be. We have no ethical value. We have no our oaths we have taken to leave the patient in preeclampsia. And she has 3 those attacks in front of the doctor and she runs away. And we lost one young mother with 8 months old baby. And what is going on that husband's, he will be under stress, so much devastated. And that's the one I'm talking about, the stress level, anxiety. Instead of giving to boost of it and keep on talking about that in those areas where our front warriors are working and heroes are working, help them with these suggestions what we can do in the stress. And I do not have much time to go in that stress area, that we should be doing these 5 things or 6 things. That reminds me to mention Dr. Mrudula Sekia, who had been in this area pioneer to be on putting on Facebook every day about depression, about suicide, about mental health, about stress, how we can help each other. And you can do very easily in your areas and in your Facebooks. Now, let me finish with the references and I will open it for questions and answers. In references, there are 140 or more than that, thousands and thousands of, and it bogs your mind out which one gets priority. To me, the priority was 14, and out of 14, if you have to choose 1 or 2, wherever you can find this information about Dr. Bartlett's, that is CVS Texas doctor who claims to have a silver bullet, which I mentioned to you, the steroid, Pulmicort, and then Bharti Kumar, how well is India responding to COVID-19 from the Brookings Education Google COVID-19 update and Indian Council of Medical Research of India, which is ICMR. And if you have to go on those other ones, please go through the travel advisory PDF. This is very informative. This helped me, and that advisory that, oh, we were missing that travel area, only 3 hours. And then in 3 hours, even we can catch infection. Let me emphasize, there are 2-3 things. In reference, I am being reminded that one person asked about raw vegetables. Raw vegetables can be used very much, but there is a protocol for that. To make it a short one was, if you are living in apartment area, then put it, ask that guard to leave those raw vegetables there. If you are a house owner, bring it and leave it outside for a couple of hours. When you bring it in, please do not take it for granted that you washed it and then you are okay and everything is dandy and okay. It's not okay. You put those in the container tray or wherever, or a clean towel, and put those vegetables, but make sure you wash your hands. The source of infection is not the vegetables, because they will be cooked. The salad, after hours, it can be eaten very well. You cannot just give it away, all those your immune boosting system, and you can eat salads, but you have to wash your hands. Where some people are fashionable, keep their nails longer. I put my nail polish also, I should have removed it before coming. But the nails should be cut short, which was our first priority before going into the wards, that we should cut nails. But here in USA, my students are coming with big nails, with nail polishes, and I have no authority to tell them no, because it is not written in their protocol of students. So nails should be cut, hands should be washed. If you keep mask on, is fine. If you're not keeping it, you're not keep on breathing on that, keep a little distance. And just hygiene. Yeah, at home also, if people are a little bit in that query area, question area, then you keep the distance. The same protocol, simple. The other question came was, with the references I am being reminded, because in that age category of 60 to 80, that those 65 years old ask, can I go out? Can I say hello to my neighbors? Then the answer was, yes, sir, very much. Yes, ma'am, very much you can go, provided you follow those 3 things. You have your mask on, you have your hygiene maintained, you keep your distance, and you are not going to touch the things and touch your nose, and you are going not to touch your mouth and not the ears. So those things, little things that I'm injecting in is very day-to-day things which we should be following very simply to go out, because I'm very much scared that our president has opened lockdown, because here time is money. Everything is just translated into dollars, and we had been very much down in economy, and he's very justified to give some kind of boost to the economy, and he's giving those instructions strictly, and they can be held responsible if those employers, those big shots who have industry people, those little employers, CEOs and employees, and the general grassroots public is not maintaining those areas of hygiene, washing hands and distance and mask. Thank you, namaskar, and I will say good night after questions and answers.
Thank you, ma'am.
Farooq, is that okay, or I can go on and on with my stories?
Yeah, ma'am, it was very much informative session. And really
you,
our
sir.
participants are also very happy because they are giving the comments on this session. Very informative
Oh,
session.
all right, sir.
Yeah, ma'am. Please over to Suchita, ma'am. Any question or queries are there?
Yes, Farooq sir. Thank you, ma'am. We'll go ahead
Okay,
and take some
Suchita, my
questions.
dear, so happy to see you on that after 17 years. Please encourage them to ask if there is any question and if I am able to answer.
Yes, ma'am, there are some questions in the question box. First is question from Sundaram Madhavan. Please give information about vaccination for COVID-19.
Wonderful question, wonderful question. Okay, now many of the countries have claimed that they have found the vaccination. But do you know, in actuality, these vaccinations are not going to be ready from 2025, but earliest some countries are claiming, and one of the country is our country also, that it will be ready by 2021. Okay, so vaccination is not there yet, but it will be. There were two people that USA also is claiming that they have got vaccination and they have experimented on the humans. And those two humans, we haven't heard much about them. Either they are not relating the information or something happened to them. So we are not up to date on vaccination, but yes, they are working on that vaccination. And if vaccination comes out, you should be very happy. And I just saw today on Facebook, our Nita Ambani ji, do you all know her name? She's Ambani, Mr. Ambani's wife, and who has Reliance. She has promised, if the vaccination comes today, she is going to provide in every nook and corner of India to give it to all the citizens, all the people of India. And that's such a big commitment. So that is my say on vaccination.
Thank you, ma'am.
You're welcome.
Ma'am, one more. Yes, ma'am. Ma'am, I also want to ask that how to sustain the education quality of our nursing colleges in the midst of COVID-19. Is there any suggested method or system for of education?
Okay, I'm going to share, and it is such a nice, exciting thing I'm sharing with you. We old pros were not used to using any technology in 2003 when I met you. And before that, when I got retired, about 4 months ago, they suddenly sent, use email, use your PowerPoint. And these two became such a nasty things and words for old people, old teachers. I didn't know what to do, and we did it. So coming back and making it short, that technology is not, we are not savvy with that. But in 20 years, we have come up to the point that being there in person also, in colleges, we were using 50% on these webinars and this long distance teaching. So bear with me, be patient, and it is going to be very effective. Trust me, it is very effective because some of my students were with the babies, with the pets. And do you know one thing? I should not be advertising. They were breastfeeding with open because they are open also, and they were having pets at their side. And I couldn't do anything. And there used to be 101 students, and my peanut hardly 5 feet, standing there in front of 101. Of course, I had a speaker, but everybody was appreciating that I had the tolerance first teacher to let them come. But I'm thinking from that point of view, if they have some restrictions, constraints, they will be benefited, but they should pay for that. And this was first thing our universities, colleges made it, that we should start asking them to pay for that, fee per credit. Long distance, but effective, but with some monetary gains to them. We people will not be left off hook. So instead of 7 days a week, we were going for 1 day, 4-hour session, and all their queries of 1 week, all they couldn't understand, all their assignments of reading, because we did study that 25 pages per hour they can read. And 7 hours in a week is not more. That's how they were able to pass their NCLEX exams, their IELTS and all this, where our students are having difficulty because they were seeing the demos in their own relaxed situations. They were not rushed in the classroom situations, and they were able to find this with the social distance, concentrating more, relaxed more, and beneficial more. Is that enough on that
Yes,
technology and
thank you, ma'am.
long
Thank you.
distance?
Ma'am, one question from our audience.
Yes.
I heard from Wuhan that people over they're using hot water from kettle. Will it kill the organism, and the person included that the organism dies within 4 or 5 days?
I I should have mentioned in the myths.
Yes.
I started doing that because somebody from India, somebody from India said we should be drinking hot water 24 hours a day in sips or in gallons, whatever we can utilize with the citrus, which is vitamin C, I should have mentioned. Please boost your immunity. That is needed. That is a scenario of today, that you boost your immunity with vitamin C. Okay. And first it used to be vitamin D for older people. Now they're saying take, in addition to that, whatever you're doing is fine, take vitamin C. So coming back to your question, that I started with that. Then I came to know it is good for nothing, because as soon as it goes in our system, our body temperature is only 98. So whether you were burning your mouth, you were going to extremes, and you were drinking 24 hours, and this tasteless thing, which I call it now tasteless thing, it was not helping, because the germs were going, or the virus were going through the eyes, through your nose, okay, through your ears, through your skin. They have lately are saying, do not rule out skin also. The first line of your mechanism of defense, do not rule out that also, through your abrasions. So I don't know for how long they live, but they are saying. So coming to one yes and no, it is not going to help, but if it is not going to help, it is not going to harm also.
Thank you, ma'am.
You're welcome.
Ma'am, next question. How to encourage parents and individuals to make their choosing nursing as their career after COVID-19 is a very big challenge.
Okay, repeat the, I did not hear the first segment. Repeat it, please.
Yeah, please. Yes, ma'am. How to encourage parents and individuals to make their vows choosing nursing as their career after COVID-19?
Oh my goodness. I wish my husband was here, but he's in heaven. But my children are there, and we go through every day, and I very happily doing consultation to help this. Now marriages, right? That's what you said after COVID? How
Yes,
we are
ma'am.
going to deal with that, being
Yes.
nurses?
Yes, ma'am.
Nurses are human beings. And if you are going to leave career, think yourself, if you get sick, which nurse will come and take care of you, right? So that keeps me going as a nurse. So if I need a nurse, I should be doing what I had been doing. So you cannot leave that with the oath. That is my personal opinion. Okay, it is nothing in mandatory guidance. Then with husbands who are not tolerating this kind of scenario, they have to be educated. There are many people who are ready, like me, to give the consultation from experiences and say, life is only that short. If you think sexual connotations and only superficially going is the means and the end of life, that is not, my dear. I came to know after 70 years, so I'm still giving you a leeway that you have enough time to come to that conclusion and take from my experience that ultimate our goal of this life is to have some kind of transcendental, that consciousness, whatever our is. that you do whatever your for recreation, part of it, for offsprings, second, but the third, your ultimate, this only little viruses should have taught us the lesson that those big, those engines and those ammunitions are doing nothing. And these viruses can take our life in 1 second, and our second breath cannot come. Let us be that. So I'm not going to say that you all become monks and you all become religious, spiritual gurus. You enjoy your life, but with the control, with some patience. I say it, give me sense shakti. I get up and say, God, give me sense shakti. So patience, but go with the consultations. Do not hesitate as husband and wife and getting some consultation. It is a taboo in India. And here every other person is going to their psych and they are proud to say, that is my psych person, psychiatrist helping me. It is not a taboo to ask, where am I going wrong? Is this only that now I am locked down and I should take out my frustrations on children or on wife? What am I doing? And wife should be also a little bit of open mind. If he's getting frustrated, the rule of thumb is if two are of the same, they will repulse, like our poles. And one has to be positive, one has to be negative in that situation. And afterwards, if she comes with the positive, the other one has to be negative to listen to her. So this one works very well. And this works with my husband of tantrums and a Air Force person who thought life is now or never. And he was on that enjoyment, recreation, and cheerful, and used to be a love of those our parties. And he's missed by those people more than I miss him. That it is not the only ultimate. Our ultimate has somewhere else focus. So try to shift your thinking. And I'm sure 90% we can do, 10% assistance can help us. Again, you can send me those people on my email and I will be happy to go with the bookish part also.
Yes, ma'am. Thank you, ma'am. It looks like we have covered all of our questions. And is there anything else you wanted to cover?
I'm wide awake and I'm into it. I'm geared up. So we are used to have a 3-hour session in our with the students. So it's okay with me. But if there is something left, I'm going through that one also. If I missed giving incubation period, and the average, they are still counting on 15 or 16 days to 24 days. Keep in mind, it is not 3 days, okay? So that was point I thought I missed in that those quarantine period.
Great, thank you, ma'am, for this wonderful session. We all are richly edified with your valuable insight and information.
I wish I could
Thank
see
you,
everyone.
ma'am, once again.
Is there any way I can see everyone? No.
Also,
okay, namaskar and good night to each one of you. It was my pleasure and my honor to be with you guys.
Thank you,
Good
ma'am.
night.
Good
You're
night, ma'am. Also, I thank
keep in touch. My dear,
yes,
keep
surely,
in touch.
Surely, ma'am. Also,
Okay,
I
dear.
thank everyone. We appreciate you being here. Thanks again for joining us today, and we will see you all in our next session. Thank you.
All right. Keep
Thank
in
you, ma'am.
mind,
Thank you,
I'm there.
Farooq, sir.
Thank you. Checking out.